Cases of syphilis are rising across the country by rates doctors say they haven't seen in decades. Experts are warning about the public about the swift rise in babies born with syphilis in Ontario. And data shows that the problem is even worse in the prairies. The national rate of congenital syphilis was approximately 30 times lower in 2015 than in 2022. So joining us this morning to discuss how this increase in syphilis is tied to gaps in our healthcare system is Dr. Anne-Marie Mediwake, pediatric infectious diseases physician at Sick Kids Hospital in Toronto. Good morning to you.
Good morning. Thanks for having me.
Well, the why is where I want to start this conversation. Why are we seeing the rates increasing so dramatically?
Yeah, so babies are obviously downstream from their mothers and fathers, and as the rates of syphilis have gone up in general, so have those in babies. And really in Ontario in the last 2 to 3, maybe 5 years, the rates have gone way up, but in the prairies, this has been happening longer than that. Bottom line, rates of syphilis overall are increased, and that affects everyone, including babies.
So what kinds of health consequences are patients facing if their syphilis goes untreated?
So for babies, if babies don't get treated properly, they may be symptomatic at birth. They have no symptoms at birth, but they will go on and develop manifestations later on that can happen in the first couple of years of life or even later. Just like an adult with syphilis can have no manifestations to start with, they can develop symptoms months or even years later.
We were talking about the numbers and how they've increased in the prairies. Just to give people a little more firm data around that, per 100,000 births, the rate of infection in Alberta, we know, is 69.3. In Saskatchewan, 175. And in Manitoba, it was just over 122. So before penicillin, syphilis was one of the leading causes of death internationally. Why do you think Canadians are not getting treated if we know it's curable?
Yeah, so I think that's a multi-layered question. I think part of it is awareness. It's a highly infectious condition. At the same time, it can often be asymptomatic or have mild, non-specific symptoms, at least to start with. So I think awareness is one factor. When it comes to pregnancy, the importance of prenatal screening, it is part of the routine testing. So getting women into care, making sure that they get the testing for syphilis is very important. So women that don't access prenatal care, for example, is a situation that would put both the mother and the baby at risk.
Doctor, connect the dots for us. How does this link back to lack of access in our healthcare? Yeah,
so this is obviously multi-layered. So part of it is the healthcare system in general, so the availability of primary care providers, that includes physicians, that might include midwives, that might include nurse practitioners. So in many regions, there is very limited access to that kind of resource. In addition, for particularly vulnerable populations, public health outreach programs have limited resources, and those are very important to try and get particularly marginalized women into care.
What are then some of the treatment options for syphilis, not only for babies with congenital infection, but for the mothers who are passing it down to them?
So the treatment is very straightforward. The test is easy. You do a test, you make the diagnosis, and in the case of a pregnant woman, she would get penicillin injections. Depending on the stage, it might vary from 1 to 3 doses. In the case of a baby, if the mother is appropriately treated, the baby should be fine. We don't need to treat them. But if the mother is not appropriately treated, then those babies get 10 days of penicillin intravenously, and that is curative if it's given soon enough. If it's missed and the baby comes in with symptoms later on in early childhood, then we can still treat it, but there may be long-term sequelae related to that infection because organ damage may have already happened.
Doctor, I want to thank you for joining us this morning. There's some really surprising numbers. Thanks for helping us make sense of them.
Yeah, one other point. Can I make one other point? One thing that we could consider in Ontario that has been done in some prairie provinces is to do repeat testing later in pregnancy. So right now what we do is we screen earlier on in pregnancy, but some jurisdictions have gone to having routine repeat testing later in gestation as well.
Good information to have out there. Dr. Anne-Marie Mediwake, thanks for joining us.
Okay, take care.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.